Great. Okay, so we'll get started. Welcome to everyone. I think I'll say very quickly just before we get started on today's event that we are recording this session. So in case you don't wish, there's a way of, I guess, submitting anonymous chats, but just to let everyone know that this is going to be a recorded session. So that's just before I start. But to get us started, good morning, good afternoon, and good evening, depending on where you are. We're very excited to host you today on this webinar. My name is Rana Asqoul. I'm the CEO of the Womanity Foundation. And it really gives me great pleasure to welcome you all today. At Womanity, we are very much committed to help end violence against women and girls, specifically with our Womanity Award program that supports organizations in the Global South. Oh, apologize. I think if we can get everyone to mute. Okay, so I think we're good. So like I was saying, we are committed at Womanity to help end violence against women and girls, specifically through our Womanity Award program, which focuses on working and supporting organizations in the Global South to adapt programs focused on the prevention of violence against women and girls. But the reason that we are here today is because we have just wrapped up a year-long selection process to select organizations that Womanity will support over the next 3 years. We will be hearing a little bit later on this webinar from 6 incredible organizations about their different experiences and different programs working on the prevention of violence of women against women and girls. But before we do that, we do have an agenda that I will walk you through. But I wanted to first also extend our huge thanks to our co-hosts on today's webinar, SVRI and Giving Women, for being our partners on this webinar today. SVRI is represented here by Aisha, who will share about SVRI's research on ethical funding. And I'll introduce, Aisha more a bit later on. But I would like to pass the word to Atalanti Muket, who is the founder of Giving Women and who's with us and our partner on this webinar today. Giving Women is a network of a diverse set but like-minded women who bring their professional skills and experiences to provide advice, strengthening projects that are directed at women and girls globally. Atalanti has always been a huge supporter and advocate for Womanity, to which we are ever very, very grateful for. And she sat on several boards, including a vice president of the board of International School of Geneva and a founding member of the executive committee of Human Rights Watch Geneva. Atalanti, it is such a pleasure to have you. And I'd love to pass it on to you now for a few words.
Yes, I'd like to say how honored Giving Women is to be part of this incredible event. Gender-based violence is sadly present in all the work that we do. If we're looking at livelihoods, if we're looking at health, if we're looking at education, there's always behind that, there are risks of gender-based violence. And although there's been a lot of work done to heal particularly women who have been the victims of gender-based violence and survivors of gender-based violence, what needs to be done is to eradicate. And so I am very honored that we are part of this process and sharing this work. And I think the collaboration, South to South collaboration, is really such a really powerful initiative. And I'm really looking forward to hearing the presentations and hoping that we can continue to work together. As Rana said, Womanity is a very close partner of ours. We love to work together. We have the same goals. We work in different ways, but that's the beauty. As I always say, I believe in the power of one, but the magic of many, and this is what we're doing today. So thank you so much for having us as a co-host, and I look forward to the presentations.
Thank you, Atalanti. I might be stealing that. The power of one, the magic of many. It's beautiful. That's great. Thank you for that. So we've got a great agenda. We'll be hearing from experts in the field, from experienced researchers all the way to the actual lived experiences from organizations working on the ground to prevent violence against women and girls across many different contexts, from Brazil, Cape Verde, Kenya, Nepal, Nigeria, and Rwanda. So we've got a really rich context here, a really rich set of experiences and work. So I'll quickly take you through the agenda. So we are going to hear from Professor Rachel on what works in the prevention of violence against women and girls. We are also going to be hearing from Aisha Mayo from SVRI on ethical funding for the prevention of violence against women and girls. And then we are going to move into a panel discussion with the 6 organizations, like I mentioned earlier, on their experiences from working in the field, on the ground, on the prevention of violence against women and girls. We are going to have a chance to open up the session for a Q&A. So you can already put your questions in either to the chat or the Q&A, and I'll mention this as we go forward as well. And then last but not least, we are going to wrap up this webinar with the announcement of Womanity Awardees, which is quite exciting. I'm going to quickly mention some housekeeping rules before we move, or some housekeeping notes, I guess, before we move into our guest speakers here today. So we have this webinar translated into 3 languages. We have translation channels in French, Portuguese, and Spanish. If you wish to access these languages, you will see at the bottom of your screen on the toolbar of the Zoom screen that you see in front of you, you will see the world globe. So that's the symbol, and it says, interpretation underneath it. You can click there and you can choose French, Portuguese, or Spanish. If you do not wish to hear this original audio, you can just click the option to mute original audio, and then you will just hear the language of your choice. Like I mentioned earlier, you can add your questions to the chat or to the Q&A as we go. So as you're listening to the different speakers, you can automatically put that in. We will be collecting the questions. We'll try to answer as many as we can, and we will answer these questions on the Q&A session, but we might also have an opportunity for the speakers to and the panelists to really be addressing these questions already on the chat for you. So we'll see how that goes. The speakers and the panelists will have their cameras on when they are speaking, to give us a chance, obviously, to have that face-to-face interaction. So these are just some of the notes. And we are ready to kick off. I will start with, we'd really start with Professor Rachel, and we are going to be hearing from her on what works in the prevention of violence against women and girls. Professor Rachel is the executive scientist for research strategy and intramural units in the South African Medical Research Council. She is the former director of the SAMRC Center for Gender and Health Research Unit, and she was the consortium director of the DFID-funded What Works to Prevent Violence global program, leading research on the prevention of violence against women in 13 countries. She is a founder member of the SVRI and is a member of the Leadership Council. So over to you, Professor Rachel.
Thank you very much, and good afternoon, everybody. I'm delighted to have the opportunity to speak at this incredibly exciting event. We've been building up to this launch for the last couple of years, and I'm excited, as I'm sure you all are, to find out which of these incredibly strong teams is going to be the one that will be given the Womanity Foundation Award. So let me provide you a bit of background and introduction. As has been mentioned, I was the consortium director for the DFID flagship program, What Works to Prevent Violence Against Women and Girls. Between 2013 and 2020, we worked in all of the red countries on the map generating knowledge on the prevalence and drivers of violence, what works in prevention, costs of prevention of violence and of inaction. And the research took place in 15 countries in Africa, Asia, and the Middle East. Although I'm talking about this, since that time, and our program ended in 2020, DFID has merged with the Foreign Office in London to form the FCDO, the Foreign Commonwealth Development Office, and they have actually launched what we're all calling What Works 2, What Works Impact at Scale. And the team that's going to be running the first part of that has already got organised and held its launch. So there promises to be many great things over the coming years from that space. I'm going to talk about the former programme. So what did we learn from it? I think this slide is interesting. This is a graph of the prevalence of women's experience of physical and sexual violence in the past 12 months from a selection of different samples, different countries that where we collected data through What Works. And then at the end of it, I've added the 2016 Demographic and Health Survey from South Africa. And if you look at the two ends of this graph, they're both blue and they're both South Africa. And one is the prevalence from informal settlements that we were working in through What Works. And what I want to show you here is that not only is there a very substantial variation in the reported prevalence of IPV, even within high prevalence regions like sub-Saharan Africa, but what we see is there may be even more variation between a country than there is across countries. And this is incredibly important because what this tells you is that when we've chosen our countries, we need to prioritize interventions with higher risk communities. We need to know something about prevalence and what may be driving higher risk in order to think about that. So the second thing I want to talk to you about is what we learned through What Works on drivers of violence. And I use the term drivers of violence rather than risk factors because I think it's helpful to shift the discussion from these incredibly long lists of risk factors, which very often have only been variables that people measure in questionnaires, to think about the underlying construct that these variables actually represent that's driving gender-based violence. And we know that gender-based violence is rooted in structural factors. Most of all, it's rooted in gender inequality, the patriarchal privilege of men, and systematic disempowerment of women. We also know that normative use of violence is incredibly important. And in settings where it's normative for violence to be used in multiple aspects of social relations, there's much more gender-based violence. And we know that these structural factors are inseparably linked to poverty and low levels of education. And these are incredibly important drivers of violence. We also know that there are individual and relationship factors, because even within areas that are equally patriarchal and violent and poor, the level of violence experienced isn't the same for everybody. So there are other things at play. We know that there's more gender-based violence in families with poor communication and poor relationship conflict responses amongst the couple. Poor mental health and substance abuse are very important drivers of violence. And where women have experienced child abuse and trauma, they're much more likely to become victims of violence, including if they've witnessed abuse of their mother. And men who have these experiences are much more likely to perpetrate. So it's incredibly important to understand these core drivers of violence, and then to recognize that there's a lot of information now about the impact of conflict and post-conflict as drivers of all of these structural and relationship factors, and therefore creating the context for a much higher prevalence of intimate partner violence. So what did we do in What Works? Well, our job chiefly, apart from measuring violence and understanding drivers was to look at interventions. And we had 4 main groups of interventions. The first was interventions that used community activism approaches to shift harmful gender attitudes, roles, and norms. And the different interventions were a bit different. So we had the Transforming Masculinities intervention in the Ituri province in the Eastern Democratic Republic of Congo. And that intervention worked with church leaders. It worked with training couples within the community on a curriculum. It worked with providing scriptures on gender equitable practices, and with stand-up interventions in communities to try and spread messages and shift attitudes around gender-based violence. Rural Response Unit system in Ghana used fairly similar methods without the same emphasis on church leaders, and they didn't have a training program, but otherwise widespread community messaging and interventions for a longer period of time. In Rwanda, we had an intervention that worked in a fairly similar way. And in South Africa, there was one that predominantly was positioned to work with men, although they worked with women as well. And there was something that was related in its community activism in Nepal. Now, what's interesting is these interventions didn't all work. We had much better data supporting the effectiveness of the Ghana intervention, the Indashikiwa, well, the couples intervention overall in Rwanda particularly, and the Transforming Masculinities intervention. But the other interventions, we didn't have such good data supporting them. And I think it's important for us to reflect, as I will do at the end, on why that might be. Our second category was gender transformative and economic empowerment interventions. These we did in Afghanistan, Tajikistan, Nepal, Bangladesh, and in South Africa. Economic empowerment ranged from livelihood strengthening to income generating approaches and women in the workforce in Bangladesh, and social empowerment training in Afghanistan. And again, we had some differences in effectiveness. And so the Tajikistan, Nepal interventions, we had very good evidence coming from there, good evidence for the impact on men in South Africa, and less so in the other settings. Our third group, couples interventions and interventions with special populations. Here again, we worked in Indashikiwa couples in Rwanda, excellent findings. Vatu looked at alcohol abuse and mental health problems amongst couples, very good findings, and less so for India and so. The fourth group was prevention amongst children, and here we saw very positive impact of interventions in Pakistan and in considerable evidence for the intervention in Afghanistan. So what did we learn? Well, at the end of what works, we put our own findings alongside the whole literature and discovered that by the end of 2018, there were 95 interventions that had been rigorously evaluated to see whether they really worked to reduce violence. And in fact, there were 9 different types of programming where it was shown that they were effective in well-designed and executed studies. I won't go through them all, but I do want to refer you to the source of this slide, which was one of our flagship reports from What Works, and to say that taken in total, what it showed us is that there is a repertoire of interventions that are effective and can be adapted and taken to scale. And that is on our What Works website is the report. But we also wanted to know, why is it that some of these interventions are working well in some countries and they're not working so well in other countries? And when we drill down into the real content of the interventions, we identified 10 elements of the design and implementation of more effective interventions that were associated with success. Amongst these, I've highlighted that there were 6 interventions with stars 6 features that had to be part of all of these interventions. And these included long enough sessions and programming, really well-trained and supported staff and volunteers, a rigorous intervention with a robust theory of change, addressing multiple drivers, working with women and men, and integrating survivor support. And the other features were important in the settings where they were relevant. This has also been written up in our key reports, and I want to suggest this is an incredibly important document for the journey ahead with the Womanity Award interventions. It's absolutely essential that interventions are adapted really well for the setting. And what we've learned is that it's incredibly important to base this on knowing your community. Local prevalence of types of violence, drivers, the cultural context and contours, and usually formative research is needed for this, where there might be desk-based research. If you've never done research in that area, I think you need formative research. The intervention to the local context and review the theory of change and adjust intervention elements if needed to address major drivers. What we learned is it's not absolutely every driver that has to be addressed in every setting, but in every setting you need to look at what the main drivers are and make sure that they are addressed by the intervention. Very important to become familiar with the intervention before you adapt it. We believe that you should go through the intervention as participants to understand it before an adaptation, and your facilitators should do that before they train in it. I think it's important to remember that adaptation expertise is a skill, and it is useful to work with skilled intervention developers or actors if you haven't done this before. Ensuring that the methods follow best practice in methodology of change is critical. And if they don't, and there are elements that you think could be strengthened, they should be strengthened before you implement in the process of adaptation. It's very important to follow the 10 principles of design and intervention as appropriate for your intervention. And it's important that adaptations need to be developed and tested iteratively. You don't plan to widely implement or evaluate the intervention until you've got promising feedback and you feel that the patient is what I call stable. And that usually means that you've adapted, tested, improved the adaptation and tested again, because these adaptations are not done all in one go. And when you're ready to implement, doing solid M&E, looking at acceptability, feasibility, and effectiveness is really important. So just to conclude, what our work has shown is that violence against women and girls is preventable in programmatic timeframes. Robustly designed and implemented interventions are absolutely essential for success. But we have a repertoire of interventions that are effective and can be adapted, and these should be used. It needs to be recognized that adaptations take time and they need to be done rigorously. Innovation is absolutely essential if we're to combat violence against women and girls. The bedrock of innovation lies in southern ownership of the creative process and localization of action. It's incredibly important that these principles underlie all of the work of the Womanity Foundation and the process of selecting the teams as winners of this award. So I want to thank you very much, and I very much look forward to hearing the rest of the program today and finding out who the lucky winners are. So thank you very much.
Thank you. Actually, thank you so much, Rachel. That was amazingly clear. You've simplified what is a very complex, a complex topic, but really to kind of go, through the drivers to community activism to reviewing some of the interventions. I found personally just the principles of design and interventions extremely exciting and interesting, especially as we went through this process of actually trying to look at, programs and interventions on the ground from that lens. So thank you so much for sharing that. That was really great. I will actually move now to Aisha. So we'll hear from Aisha Mago, who is the technical advisor of SVRI. Aisha has worked for over 2 decades as a feminist researcher, activist, and trainer, focusing on the rights of women, children, and adolescents in the context of violence, discrimination, sexual and reproductive health and rights, HIV, and access to justice. Aisha, it is such a pleasure to have you with us today. I will pass the floor to you to hear more about ethical funding.
Oh, hang on.
Yeah.
Okay, I was muted.
Yes, we can hear you now.
My first 20 seconds. Sorry, I'm starting again. Okay, thank you so much, Rana, and thank you, everyone. It's great to be here. Thank you for having me speaking at this amazing event. I'm speaking to you from Cape Town about this project that we've been working on since February at SVRI that we like to call Funding Ethically. So the key objective of, and we can be on the first slide, please. The key objective of this project was really to create guidance in consultation with funders, with researchers, with practitioners that could contribute to better funding for research on violence against women and violence against children in lower and middle income countries. Although our specific guidance is really for research funding, the principles that we highlight are relevant for donors funding programmatic interventions as well. And we really hope that the guidance will be useful for a range of donors. So just to start off, what did we really mean by better funding? Well, in some ways, the entire purpose of the project was to find that out in consultation with the field. But of course, we did have some of our own ideas, you know, how could it look? What are the possibilities? What's really important to SVRI and the way that we work? And some of the things that we knew would be very important was funding that is grounded in feminist principles, funding that acknowledges honestly and addresses power dynamics, involves honest and transformative relationships between donors and grantees, and finally, that does create accessible and equitable processes that support LMIC researchers to do really impactful work in lower and middle income countries. We used many different methods through the process. We started off with a scoping review, which we used to look at existing guidance because we were clear that we wanted to avoid duplication. We also wanted to advocate for great resources that are already out there, and we've done this in the guidance so that we refer, we can refer people to the different aspects that already exist. We ran several consultative processes because we were very, very clear that we wanted this to be something that was co-created in consultation with the field. And we ran 7 focus group discussions with funders, with researchers, with practitioners. We had an online survey that stayed online for a full month, and we had over 70% of respondents for that were researchers and practitioners who were working in lower and middle income countries. And we had an advisory group that was constituted from the start, and they provided guidance and strategic oversight throughout the process. The next slide, please. So through the process, we really collated a set of key principles, and that's what I'd like to highlight here. So decolonizing knowledge and methods of learning, this was one of the key 4. This was to talk, and what we investigated was how you rethink the questions of what constitutes evidence and expertise, how is knowledge created, whose voices are heard, and indeed whose data counts at the end of the day. The second one was around creating equity in research partnerships, and this came up during the consultation from multiple perspectives. So including localization, diversity and inclusion, research, translation, authorship, and dissemination. So just to give an example of how it relates to our action points, key issues or action points for funders that are related to this principle, which would include, for instance, involvement of local researchers and implementing partners from the very beginning of a research process as co-producers of knowledge, and additionally ensuring that agreements related to authorship and presenting of work are made early on in a research process and are fair and inclusive. A third one is around ensuring funding is flexible, adaptive, and long-term, and where possible, unrestricted. This is a really good example of a principle that is relevant not just for research, but in different contexts as well. For instance, funding women's rights organizations to do their work and funding resilience and sustainability, because this principle considers how donors can include money for core costs and for overheads that allow organizations to focus on their core work rather than constantly struggling and fundraising. In terms of researchers and implementing partners in lower and middle income countries, the whole concept of flexibility within existing funding and programmatic arrangements came out as really critical to allow partners to adapt their project, to adapt services, activities to changing contexts and to extenuating circumstances that may arise all the time in different types of research projects. I mean, these things obviously constantly happen, but COVID is the most obvious example, and the example that all of us will have had some experience of in terms of needing to adjust and find ways to work differently. And a great example came for us from an SVRI grantee who said to us that, yes, COVID meant that rethinking the intervention was a must, but the SVRI completely supported us. They gave us ideas on how to adapt the intervention, sent us the relevant papers and documents, gave us feedback on what we proposed and several comments that would make the adapted proposal more real. What really struck us was that they said it helped us a lot knowing that SVRI want the project to finish well, not just on time. And I think this was a really learning example for us and leads us on to the fourth principle, which is really about transforming the funder and grantee relationship. And what I mean by that is encouraging an affirmative approach that emphasizes that both parties, in fact, do have the same objective of really wanting the project to finish well or to succeed, and that partnership can be based on trust and this collaborative approach. So, you know, rethinking what it really means to be the one who's giving the money or the one who's accepting it, creating aspects such as offering non-financial support, having transparent and open communication between donors and grantees, simplification of processes. So these are some of the sort of examples that really came up as very strong for us and that we tried to highlight in our action points. The next slide, please. And this leads me to sort of the final aspect of what we've done in the guidance, which is what we tried to do was provide practical ideas and tips for each stage of the research funding process through 7 different stages. So these aren't meant to include every type of project and every type of funder, but they are, we think, a not so hard to implement set of actions that could make the field happier and more equitable. So I really want to quote one of the researchers who participated in the online survey, and they said, you know, consult LMIC researchers in developing grant application procedures, ensure there's sufficient time to apply. They don't have the same capacity to produce large funding applications under difficult circumstances, demand less in terms of personal and institutional capacity, and use different metrics to measure the capacity to do the work. If you keep funding the same people who already hold grants and have publications, how is it going to change anything in LMIC settings? So, you know, I really liked that quote, so I threw it in here because it also like really brings to life, you know, everything that we engage with during these processes, and people put a lot of attention and time into sending us responses, and we've really tried to be true to that in the guidance and to include that in the guidance. Next slide, please, and I'm done in case I'm out of time already, but I am finished. This is my final comment, is just to say that the guidance will be available very soon. We really hope that many of you will be interested in reading it because it really does include a lot of inputs from lots of different people who are working in this field. I will share these links that are on this slide in the chat box, since this work, which is all around how to fund better, has been part of other SVRI processes, very important ones, including working collaboratively to create a global shared research agenda, which identifies research priorities for funding, as well as another study on tracking funds for research, so that ultimately we have a package of resources which are around what we fund, where the funding is, and how to fund as well as possible. Okay, that's it from me. Thank you for listening. Thank you so much.
Thank you so much, Aisha. That was, there were some really great insights. What I, personally also find really helpful and useful is to be constantly reminded about this, and to be constantly reminded about, the implications, not only that, but also how to move the needle, how to change, how to shift. So some really great work. Thank you for sharing it with all of us. Now I'm gonna move to Laura Somoji, our director of the Womanity Award program, who will introduce us to the finalists. So Laura, over to you.
Thanks, Rana, and thanks so much, Rachel and Aisha, for your great presentations. Really insightful and really putting these all pieces together. I think it works really well. So thank you so much for sharing. Well, I think I feel very honored to be introducing the finalists. I have been working very closely with them for the last at least 3 months. They have been through a very long process and thorough process of selection. We had a record number of proposals this year. We had 165 proposals from 24 countries. So just to be here today with them and for them to have gone through all these processes, I think already a reason for them to be celebrated. So this year, the award is focusing on prevention of domestic violence against women and girls. And I just want to introduce who the 3 pairs of finalists are. And then I'm gonna hear from them as well. And we're gonna have a discussion with Rana moderating and also open for questions from the audience. So the first pair is CARE International, both of their members in Kenya and Rwanda, and the Center for Rights Education and Awareness in Kenya. The second pair of finalists are Themis, Gender Justice and Human Rights from Brazil, and Associação Cabo-Verdiana de Luta Contra Violência, Baseada no Género, which is the Cape Verde Association for the Fight Against Violence, Gender-Based Violence, based in Cape Verde in Africa. And the third pair of finalists are Scripture Union West Africa from Nigeria and United Mission Nepal from Nepal. So as you can see, it's a very diverse set with collaborations from Africa to Latin America, Asia and Africa, and Africa to Africa. And that's exactly what we're trying to do with the Womanity Award, is really to catalyze the South to South collaborations. So what we're gonna do now is just gonna have a quick round of introductions. So we're gonna play a video. So the finalists prepared videos to talk a little bit about the work they want to do together. So we're gonna play the videos and they will introduce themselves, and then we're gonna have time for the discussion and for them to be able to share more about the amazing work they are doing in their countries and the plans to work together. So, Rudo, if you can share Lizzo, the first video.
Intimate partner violence is a global problem, with statistics showing that 1 in 3 women globally face IPV. In Kenya, more than 41% of women have faced IPV in their lifetime, and IPV rates are especially high in Meru County, where women have a 65% chance of experiencing violence in intimate relationships.
Siku za kwanza maisha ilikuwa nzuri. Akaanza kuwa ananichapa nyumbani. Si mara moja, si mara nyingi. Tukaongelesha na family. Huo wakati alikuwa ana apologize. Ikafika wakati sasa akaacha, akaninyorosha, akanipiga. If nothing is done to prevent violence in intimate relationships, women like Nkirota in Meru County will continue to realize poor social development outcomes. Kenya in general and Meru County in particular does not have an evidence-based intervention that prevents intimate partner violence. Majority of interventions mostly focus on response. CREW, Care Kenya and Care Rwanda are looking to adapt the Indashikiro model in Meru County. It's an evidence-based model that works with intimate partners to provide them with practical tools to address power imbalances, promote effective conflict resolution, and equitable decision in their relationships, which also contributes to an enabling environment through activism, safe spaces, and sensitization of opinion leaders. The model was implemented by CARE in Rwanda and successfully reduced intimate partner violence by 55% in areas where it was implemented. We anticipate that successful adoption of the model in Meru County will reduce IPV rates by at least 20% over a 3-year period of implementation. Overall, we expect that intimate couples in Meru will experience healthier, violence-free relationships. Indashikiro works, and we want to make it work for Kirote. She and many others deserve a chance at a happy, healthy life. So let's join hands and give them one.
Great. So if I can have Dorothy, Theo, and Wangeshi, if you could quickly introduce yourselves so the audience can see who you are.
Thank you very much, Laura. Greetings all on the call. My name is Dorothy Aseo, and I'm joining in from Nairobi. I am the Assistant Country Director, Programs, Care International in Kenya. Thank you very much.
Theo or Wangeshi?
I think I can go next. Greetings, everyone. My name is Wangeshi Washira, and I work as Executive Director of CREW. CREW stands for Center for Rights, Education and Awareness. We are a feminist organization based in Nairobi, but also working in different parts of the country. Our work focuses on issues of women's rights, and we're very, very excited to have come this far and really looking forward to partnership with Womanity Award. Thank you.
Hi, everyone. My name is Teofit Twahirwa, and I work for Care International in Rwanda as the head of Knowledge, Learning, and Opportunities Management. Our program in Rwanda generally focuses on two pillars: women economic justice and climate change, and second, the gender justice and right to health. We implemented Indashikirwa Intimate Partner Violence Prevention Program as a part of What Works to Prevent Violence Against Women and Girls, and due to its success, it actually informed the Great Lakes GBV prevention model, which is called the POWER, and addresses issues at individual, household, community, and national level. So regarding women economic justice, we scaled up the CARE's flagship program, which is called the Village Saving and Loan Associations, and you have around 40,000 saving groups with more than 1 million members, and 75% of them are women. All other interventions, they use saving groups as entry points. Thank you. Over.
To be implemented in Cabo Verde, Plus in Pamojer is focused on preventing domestic violence and its intersections with gender, race, and class. Through community activism of legally empowered women, it will produce changes and associate factors of gender-based inequities, preventing violence and promoting the rights of women and girls in the communities.
A gente luta pelos direitos das mulheres. A metodologia usada do curso nos tratava como igual, dá autonomia para que a gente possa fazer a diferença. E ser promotora legal popular é isso, é fazer a diferença na vida das mulheres. E a gente vai criando estratégias com essa mulher para evitar aquela violência até o ponto dela conseguir fazer essa ruptura e podendo ser realmente livre. Mas é muito importante a gente ter essas estratégias de prevenção. Então, cuidado com a capacitação, seja num clube de mães, seja numa UBS, seja numa escola, ela é importantíssima. Porque é isso aí que vai garantir a mudança, que a gente não sofra mais violência.
Benuta está sempre ligado com o VBG, para a minha hora que hoje uma mulher, ele está sofrendo violência, a mulher pode ter que pensar, mas só violência física, violência baseada no gênero, é grande coisa para nós. Para tinha mulheres, depois de que tem luta contra o VBG, um monte de mulher alivia. E vira põe mão na peta e fala, a mim eu tono. Então, por isso, na associação é isso que nós fazemos. No sim para a mulher.
Sim para as mulheres.
The program will empower women, increasing self-esteem and knowledge about rights, enabling them with skills and tools for access to justice, to become agents of change in their communities. We expect reducing incidents of domestic violence in Santiago and Fogo Island by addressing the deconstruction of gender-based inequities.
Thank you, Lizo. So I'd like to ask just Virginia and Christina to introduce yourselves briefly. We are a bit late on the agenda, so I'll ask you to be brief. Thank you.
Hi, nice to meet you all. My name is Virginia Fikes. I have a law background. I'm a feminist and human rights advocate. I'm Themis co-founder in 1993 and also a former executive director. Themis is a feminist anti-racist organization in the south of Brazil, and that's been working in 3 main areas: advocacy of rights, technology and justice, and legal empowerment. In this field, we have been developing an internationally recognized strategy that is called Popular Legal Promoters Program. And this is to face violence and to ensure gender equality in the community through community activism. And it's the program as an innovation partner that we are presenting to be implemented in Cabo Verde in partnership with ACOC VBG and Womanity Foundation. Thank you.
Thank you, Virginia. Christina?
Hi, I am Deborah Cristina Vera Cruz. I have a degree in computer engineering from a university in Brazil and a master's degree in geographical information from a university in Cabo Verde. After some years of experience, I decided to make a shift in my professional career. I wanted to make a more impact in people's life with the job I was doing. And that is when I started working with Associação, the Cabo-Verdiana Association for the Fight Against Gender-Based Violence, and coordinating projects in different areas such as labor rights of domestic workers, gender-based violence, woman empowerment, and youth education for the prevention of violence. The organization was created in 2016, and it has a focus on the promotion of gender equality, prevention and combat of gender-based violence in the country. The association is member of a very important network that we have here. It's Rede Sol, that works with victim support and also actions of prevention of violence. The organization has a very strong experience in community work, in the prevention of violence, working with different groups, not only women, men, boys, young girls, but also specific groups such as women domestic workers, gender-based violence victims, women's street vendors, among others. Thank you.
Thank you, Christina. So Lisa, if you could play the final video, please.
Home is not a safe space for everyone. Gender-based inequality and violence against women is a hard reality, and it's a reality across the globe, from homes in the flatlands of Africa to homes in the hills of Nepal. Yes, it's deep-rooted in our societies, but we can change the story. Inspiring stories of change from Scripture Union West Africa, SUWA, their amazing experiences of working in communities to build equal relationships gives us the motivation to move forward. From SUWA's inclusive program targeting the men and boys as allies, we see a man writing a letter.
Dear ladies, this is our apology letter to you from a sincere heart and a repentant mind. We write to make it known to you that in the past we have made mistakes that we can't pay for the hurt. Please forgive us.
UMN's track record of building capacity, partnership and good networks in this region since 2005, and UMN's strong governance structure with an experienced leadership and highly competent field managers who engage actively in the field gives us the confidence to bring changes here at the grassroots level. Together, we want to build transformed families in Nawalparasi, where women value themselves and realize their rights, where there is an end to domestic violence, families where women and girls move from oppression to respect, where individuals thrive as equals and as dignified beings.
Great. Thank you. So I would like to invite Sabu and Rhoda to introduce yourselves briefly, and then you can go to the conversation with Rana and the audience.
Thank you, Laura. Hi, everyone. Warm greetings to you all from the Nepal. My name is Sabu. I work with United Mission to Nepal as a cluster team leader. Thank you. Over to you, Rhoda.
Hi, everyone. My name is Dr. Rhoda Udanyi I'm the Executive Director of SUA. SUA is Scripture Union, West Africa from Nigeria. I'm someone who is very, and with my organization, passionate about the issue of fighting against genders against women and girls. And thank you all for being here today.
Thank you so much. Thank you so much for putting these videos, the great stories together. And now hand over to Rana to moderate our panel discussion. Thank you so much.
Thank you, Laura. Thank you for the videos. If I can just ask the panelists from our organizations to switch their video on, that would be great, because then we can have a discussion, all of us. I will be kind of asking, 3 questions. We'll limit it to that because I know, we want to hear as much as possible. And I'll start maybe with a question, because we have just such a range of countries, really, that and programs, obviously, that we're talking about here. I wanted to ask about the main challenges to prevent violence against women and girls in your countries specifically, since we have 6 really different countries here that we are covering. And maybe just to kind of run this, maybe we start with, Virginia, and then Christina. We move to Rhoda and Sabu, and then Wengeshi and Theo from Rwanda as well. So maybe we can start with that. What are the main challenges to prevent violence against women and girls in your countries? Over to you, Virginia.
Thank you. We have historical challenges, but I think we have to focus on the present ones when we are facing pandemics. And in Brazil, the information is that 1 to each 4 women up to 16 years old has suffered one form of violence during the last 12 months. And instead of strengthening the strategy of campaigning and raising awareness to society, the current government reduced budget and also discontinued services that were provided through existing programs. So worse than that, the projects that they are putting in place, the new projects of this current government, are anti-rights, anti-human rights, and they use as a flag a so-called a fight against what they call gender ideology. So the challenge is really to potentialize progressive forces and alliances in civil society and media to ensure the execution of the existing programs and to strengthen our network. Really, we have an important one with 45 organizations that are groups that works with popular legal promoters in Brazil, and that are in the field working to shift these harmful gender-based attitudes, roles, and norms, and who can be inspired by learnings as we have been today given to us by Rachel. Thank you.
Thank you, Virginia. Yep, Christina, please.
Okay, thank you. So beyond the fact that Cabo Verde is a patriarchal society, like it is common to most of our realities here, and just because of that causing inequalities in gender relations, which are very much rooted in our culture, that creates a society, a social context that is not prone to prevention of violence per se, because of the lack of openness of the society to receive what we want to bring in terms of prevention and to absorb this theme. But what I want to say is one of our main challenges in preventing violence against women and girls for us is the fact that there are not enough resources to continuously dedicate to the necessary activities. And also not only resources, but also accurate data that with the resources we have to make it more effective, the work in where it exactly needs to be done the most. So although we have plans and legislations in our country that says that sensitization needs to be done and continuous information, still the resources that are allocated are not sufficient to cover all the needs and the demands. So it is a responsibility of the government to make these resources available, but we see that civil society does its work in Cabo Verde with the resources that it has available. So that is why we are proposing this program, such as the Flasimpa Mulher, the Women's Leaders Legal Training, and the community activism that comes with it, because we see it as a way that we can, as civil society, fulfill this gap in the country, support the government having additional funds, and to do a work that is more structured and continuous in the prevention work. Thank you.
Thank you, Christina. Rhoda, Sabu?
Yeah, once again, it's afternoon in Nigeria, so let me say good afternoon and good day. The challenges, one major challenge in Nigeria is that violence against women and girls is seen as a culture, is part of the system. And so you have the culture of impunity, where in communities, as Africans, we are communal people. And so once someone commits an offense, to be able to get justice becomes difficult. The whole community comes and says, it's our brother, let's try to settle it. We take it home and settle it. And so impunity reigns supreme. But our program, bringing service providers, lawyers, social workers, health workers together, is helping us to break the silence and break this culture of impunity, and people knowing that that culture needs to change and is changing. Thank you.
Thank you, Sabu.
Thank you, Rana. There are many challenges in preventing violence against women and girls in our country, in Nepal. But I would like to share 3 key challenges. And one is the lack of implementation of laws, developed in preventing violence against women and girls. That is, the poor implementation of law is one of the key challenges in Nepal. And another one is quite related with Rhoda as well, just she said now, that the violence against women and girls is accepted as a normal behavior in all culture across the country in Nepal. That is also one key challenge in Nepal, and not treating the violence against women and girls issues as a serious issue, and not prioritizing the issue in issues to address by the plan of government. That is also another key issue. And the third one is the poor protection mechanism at government level to support to the domestic violence women and girls, I mean the survivors. And that is also the key challenge in Nepal. Yes, thank you.
Thank you, Sabu. A really interesting range so far, but I'd love to hear from Wangechi and Theo as well for your specific challenges as well.
I think I could start. Thank you, Rana. And I'll just share, beginning of this year in June, CRU conducted a study to be able to find what are the challenges when it comes to prevention work here in Kenya. And I'm hoping that I can be able to share the findings in this webinar. But allow me to share some of the key findings in terms of policy, but also in programs. And one of the things as a country is that the country, first and foremost, doesn't have a government-driven program when it comes to policy around issues of violence against women. And majority of the programs are then done by civil society organization or women's rights organization. And therefore, they're very, very small scale and therefore very, very difficult to be able then to be implemented at scale. My number 2 is that there's lack of programs that really address the behavior change. What we have seen a lot of work that has been done is around awareness creation. And very, very clearly that awareness creation doesn't then bring the transformation, because it's one thing for people to know, but there is no behavior change. So for me, that if you're able to go deeper, address issues of social norms, address issues of gender inequality, then we can be able to bring significant change. My third one is around in the country, that there's a lot of focus when it comes to issues of response. So a lot of resources have been then committed to respond to cases of gender-based violence or violence against women. And in analogy of the river, it means we are downstream, and a lot of work is not being upstream to be able to find out where the women are being violated. My fourth one around this is that most of the programs then also do not have adequate time for implementation. We have programs being implemented between the period of 6 months and 12 months. And then this means that for women's rights organizations who are already doing a lot of weightlifting, is that they cannot be able to do this work at scale. And then, of course, then this cannot be able to bring the meaningful change that we're looking at, to look at issues of social change, attitudes, social norms, and gender inequality. So I'll stop there, but I'm hoping that I'll be able to share the link that has the study findings and some of the recommendations that we've made. Thank you.
Thank you, Wangeshi. Theo. Yeah.
Hi, everyone. For me, I would say that in Rwanda, we don't have many issues, especially regarding the policies, except the sexual reproductive health and rights policy, which is now being discussed. But in terms of the challenges, we are also the same society where social and gender norms, they are really deeply rooted in the culture, in the traditions, and in the practices. And this leads to gender inequalities or stereotypes being accepted in the society. And of course, the power imbalances and the misuse of power, especially among couples. We have good policies, but in the context, the gender equality still needs to be demystified to fit the context, because there are people who are still believing that gender equality policy is in for women against men, and we really have to challenge this. And the other issue is that there is lack of knowledge of gender and GBV policies among the local authorities, especially at the centralized level, where the household conflicts they are handled. So some of them, they are still being influenced by the patriarchal aspects, which have been addressed in our policies. And as my colleague Wangeshi said, there are people who still believe that short-term funding can really address gender norms, and addressing social and gender norms requires more time. So short-term funding is really not helping. And the other issue is the week of civil society organizations to challenge harmful practices and actually challenge policies using evidence from the community. So therefore, for this to be addressed, we still lack cost-efficient, successful approaches and tools to empower communities to fight themselves, to fight violence against women on their own. So the transfer of knowledge, skills, and tools is really very critical, and they have to be cost efficient. Thank you, over.
Thank you. Thank you to both of you. Dorothy, I don't know if you want to add as well anything from your side.
Sure, just one addition is that in Kenya, most of the domestic violence or intimate partner violence happens at household or at family level. And the state also condones this by lack of actually having very good mechanism to prosecute gender-based violence crimes. So this is an area that actually we really are looking forward to have rigorous interventions and support across stakeholders to have that as
Dorothy, did I lose you, or can anyone else hear Dorothy?
It was fine, Rana.
Oh, it was fine. Okay, sorry. I lost you a little bit at the end, maybe my connection. Apologies for that. Okay, great. I think between really the challenges across the board that we heard, it almost covers everything when we talk about challenges for ending violence against women and girls, from government to implementation to investment in interventions and prevention. So thank you. It really gives us a broad range. I will shift gears from challenges to go as well around and hear really on maybe the impact specifically, so and the impact of the program that are going to be adapted. But I really want to focus on talking of how you think impact will happen in the communities that these programs are targeted at, and maybe we can go in the same order just for simplicity from the groups here. So we can start with Virginia, Christina, and then move as well.
Okay, thank you. So I'll be answering this question on behalf of the pair. We think that with the implementation of the project that we are proposing, we hope to contribute to reducing the incidence of domestic violence in the communities where we will be intervening. So it is Santiago and Fogo Islands, 2 islands of the country, Cabo Verde. And we will do so through the woman leaders trainings in the community. And this training will empower these women, will increase their self-esteem and their knowledge about their rights. It will also give them access to more information and all the tools that they will need in order to disseminate this knowledge also in the communities and the schools where they will be working in a moment after the training. And they will be acting in primary prevention. And they will also have an improved dialogue with the victim support services that we have already in the country. But we also think that it will allow them to provide counseling and accompanying women in situation of violence in these communities where they will be working, where these women are, and making these women aware of their rights and help them leave the violence cycle. And with this, they will be also working in the secondary prevention strategy that we are proposing. So with all this work done, this community activism and that we foresee in the project, and if it is all implemented in a concerted way, we believe that we will culminate in a change of mentality, attitudes, and behaviors regarding gender norms, and that way it actually contribute to reducing the incidence of domestic violence, which is the impact that we see that we will have. Thank you.
Thank you, Christina. Theo, maybe you can share with us a bit as well on the impact specifically that you foresee. I think you're on mute.
Sorry. For me, in terms of really delivering this program with the aim of having impact, this work needs to be done by people who are passionate about it. So staff delivering the program, they must really themselves and believe in the program and go through a process of self-reflection and changing themselves. And we need to make sure that, second, the GBV prevention messages, they should reflect benefits for men, for women, for children, and for the household as a whole. As a result of the program, we consider gender, but we also need to consider inclusion. And the other thing, we feel that delivering the program in a way that we are transferring knowledge, skills, and tools to the communities, for the community actually to own the program, the process, and start using the tools for their benefits in fighting violence against women and girls. And we also, because we are adapting the couple training in the context of Kenya, the trained couples, they will become change agents who will serve as role models, challenging harmful beliefs, behaviors, and practices in their communities. And this will enable amplifying the impact at scale. And of course, in order to have sustainable results, we need to make sure that we are influencing the government in terms of institutionalizing what works to prevent violence against women and girls. Thank you.
Thank you, Theo. Sabu, maybe a bit on the impact that you foresee as well for your partnership.
Thank you, Rana. With this joint adaptation program plan, we have been seeing the impact after implementing this project at individuals, families, and community level by transforming their attitude, behavior, practice, and at policy level. We will apply the transforming masculinities approach, including journey to healing and psychosocial support to the domestic violence survivors. And also we will be supporting them in livelihoods and economic empowerment so that they can, the survivors can sustain themselves, and will help them to be economically empowered. Mainly, we will develop the gender champions, and they will be conducting community dialogues in various community groups of women, men, boys, and girls, including local government stakeholders and other wider level stakeholders to join hands together to address the issue of domestic violence against women and girls at the local community level. And we'll be engaging men to address the issue also. All together, we are hoping to impact at individuals, families, and communities level through changing in attitude, behavior, practice, and policy level. Yeah, that's all, Rana. Thank you.
Thank you, Sabu. That was, I think it was really great to kind of plot challenges and then talk about, specific impact. I do want to point that we do have articles posted as well on each of the pair of organizations, really to dig deeper into the work that they do. So please have a look at these. I will ask one last question. And if we can have very quick answers, because I know we're running against time here. So very quick answers, but I really want to have, again, one last question around how COVID has really put additional challenges to the work to be implemented, the foreseen work, and how COVID has really is on your mind as you're thinking of adapting and impact. And again, would like to hear really quickly from all of you. It would be great to have a focus on that.
As Christina has said, our strategy is a legal awareness strategy and to empower women's self-esteem and skill building, to engage them in the work they will do in the community through a community care model that is done through a plan of action. So we have two main important things to think about in the adaptation. That is, first, the content, the curriculum of the training. Since we have very different laws in each country with different framework, we have different state services in health, justice, and social care, the services that are networking to provide the women's rights. So we have to adapt the reality. And the second issue is about the plan of action that will be built in each community. Since in this new program in Cabo Verde, we are going to work with men and masculinities. We are going to work with students in school. And so we have to be very aware about the new context and the cultural specificities that we're going to face in each island we are going to work. Thank you.
Thank you. Maybe Wangeshi or Theo on COVID impact specifically on the adaptation?
Yeah, thank you. This is actually a critical issue. And when you look at Indashikirwa and how it is delivered in the 4 components of couple training, facilitating safe spaces for women, community activism and training of opinion leaders, they all require to have people in the same place and having a meeting, reflecting, interacting, and actually organizing reflection sessions. So for this program, definitely defining COVID-19 prevention protocols on how this program will comply with the context, they need to be defined considering how the activities are planned to be delivered. And we know that success of this program, before you even do community activism, the couple training has to be successful, and this is key. So with the standard of having 15 couples into one class when they are being trained, when the situation changes, we might decide to split this class into 2 classes in order to observe social distancing and avoid actually losing interaction, which is needed in the training, in the meetings, and in the reflection sessions. And we also need to ensure that the places where we are conducting the activities, meeting venue or training venue, they comply with all the country prevention measures. They have spaces, big room, doors and windows to air. And then we'll also make sure that activities will be adapted in case there are new measures, because the situation keeps changing. And the good news is that we know that Womanity will also support adaptive management when we are implementing a program like this. So adapting activities will be part of this. And where it is possible, the situation is different in different countries, but where it will be possible, we encourage the program participants to really get vaccinated where they can really access vaccines. Thank you, over.
Thank you, Theo. So I'm just looking at the time actually, and I'm thinking that we probably will maybe address that maybe on the chat with Sabu, for the COVID challenges. But I'm just conscious of the time and conscious that we are getting really close to our end time, and I want to leave the floor open to maybe take one question, 1 or 2 questions from the audience. So I can see a question here. So please, if there's anyone, I'm going to take one question that is already here. And we have a question from Olivia. I am from Papua New Guinea, and our data of violence against women is twice as the global rate, according to WHO. My question is, do any interventions include financial empowerment, as it is a means of prevention of violence against women? So this is obviously a question to all the organizations here. Does any of your interventions include financial empowerment as a means of prevention of violence against women? And these could be in general as well. So we might open up to experiences, not just with the programs being adapted, but more general ones.
Rhoda has her hand up.
Yeah. Okay.
Yep, please go ahead.
Okay. Yes, we have a program on self-help groups. Some call it Village Saving and Loan Association. It's a program that empower women. They stay in groups, contribute shares, and take loans and build up their businesses. We have seen that it's also a program that is sustainable. For example, in Nigeria, SUA has over 100 self-help groups that are functioning, and 45% of those groups are from communities where the project has ended 2017, 2018, but the self-help groups have continued to grow. Why? Because dependence on men has always been part of the issue that bring up issue of domestic violence. And we know that when a woman has resources, that resources is for the family, is for the husband, is for the children. The woman is a mother with a large heart. And so she shares her resources with everyone. And there's no food before she goes to bed. She's not able to sleep. And she wakes up, she's troubled about her children. But we've seen with this program that women have increased income. It has affected them mentally, being able to sleep better, have their And husbands have confessed, actually, that they didn't know that their wives had this potential before now. They were depriving them of bringing out the potentials that they have. And so for me, any intervention that has to do with violence against women and girls should include economic empowerment. And within that group, gender transformation issues should be discussed, rights of women should be discussed. Like our own VSLA here, or self-help group, they have even social intervention funds where they help each other if there's any crisis. So it brings about social cohesion. I think it's something that should be promoted. Thank you.
Thank you. Thank you, Rhoda, for that. That is very helpful. I want to thank you all for offering your answers as well to the earlier session. Again, just to kind of take a look at the time, I will pass it on to Laura for the big announcement. So this is the part of the panel where we announce, and I will pass it on to Laura to do that. And let's see how we do on time. We might, just come back and have a collective celebration here. So over to you, Laura.
Hi, Rana, thank you. And the first thing I want to say is that there are no losers or winners. I think, as I said before, the three pairs have been through a very long way, and there's been a lot of learning from Womanity side, for sure. And just to be here, three finalists after 165 initial proposals is already, I think, a reason for celebration. You all know how thorough and demanding the process was at the end. So, and for the first time, we're going to be giving seed funding for the two runners-up. So all the organizations will have some support, the runners-up to pilot or to start trying the initial ideas that you have in your proposals. But unfortunately, Womanity can only support one pair for the next 3 years. And we support the adaptation process, and we have discussed a lot about the importance of doing thorough adaptation and just understanding the context. We also support institutional strengthening and amplifying voices to give visibility to the organizations and to the work you're doing. And also for the first time, we'll be providing support to self-care. So I'm really, really pleased to announce that the awardees this year are Themis and Associação, Cabo-Verdiana. Massive congratulations. But I'm happy for all of you.
Thank you. Oh my God. Cristina, Themis, HCLC, Verde, Womanity, thank you very much. And all the pairs that were here with us, because we know this partnership doesn't stop here. And all these groups are going to be working together. And we have much work to do now that we know each other, the three pairs. Thank you very much.
Thank you so much. And thank you, all the partners. And we'll be talking for sure to discuss the opportunities even without Womanity. So we want to be sure that we will be strengthening the relationships that started with this process, and it doesn't stop here. So Rana, I'll pass over to you to do the closing remarks.
Thank you. Thank you, Laura. It's good that we were recording the session because Christina and Virginia, your reactions were incredible. So congratulations to you for winning, but also to all of you, really, to all our finalists. This has been a massive process that each and every one of you actually made it to the stage because of the amazing work that you do. It was an extremely difficult process to get to choose only one, but we do hope and actually know that you all have robust plans, that there will be other organizations that will support this for you. So really just thank you all for the amazing work here. But I also want to thank also Laura, specifically from our team, who led an incredible process for the last year. So a massive thank you from Womanity to you. I also want to thank our co-hosts, Svri, Giving Women, our speakers, Dr. Rachel and Aisha, and really, all of you that have joined us for this, great moment, I think. Thanks to all of you who attended. I hope you found our conversation insightful, and I hope we can find more ways as well to work together to prevent violence against women and girls. It's a big topic. It's a big, a long journey, but together, like Atalanti said at the beginning, the power of one and the magic of many, we can make everything happen. I'm wishing you a very beautiful end to the year with your loved ones. I wish you health and hope for the New Year's, and I can see the amazing messages on chat. But we are right on time, which is great given what we have managed to cover. Thank you all again. And we'll leave it at this. We'll see you soon. Congratulations again, and thanks again to everyone. Take care.
Thank you so much, everyone.
Thank you.
Bye-bye. Thank you.
Bye, bye-bye.